Okay? This here, hypermagnesium, and you're going to break after this one because this one's a bitch, and I need to spend a lot of time here. Hypermagnesium. This, and way over here with this, makes you remember this, which is that mag and calcium are the same. They're very similar. Why do I say that? Because over here, I told you that a high calcium made everything real low. Didn't I? Okay, same shit over here. A high mag makes everything real low. In fact, in my field of nursing, obstetrics, we call this You done magnetize that patient. Because you magnetized or tasered them or something because they can't do nothing. So what is it about this patient? All vital signs are low. Everything is low. The most important assessment on this patient, the most important assessment on this patient is reflexes. This patient will have diminished to absent reflexes. If they're absent, oh my God, we need to give the antidote, which is calcium gluconate. All that's written in there for you. I'm going to go over it. Okay. So what we say, y'all, check it out. The outside of the board, because the whole damn board was hyper, but the outside of the board had mag and calcium, and they were the same. And both of them, when they're high, everything is low. Okay. Now, you're sick. Oh my God. You're so sick. Nausea, vomiting, diarrhea, drowsy, lethargic, weak. Keep on playing. You're going to have a loss of consciousness. Keep playing. You over there selling Girl Scout cookies at the nurse's station while your little patient is diminishing. That's what's going to happen. You're going to walk in there and you can't wake her up. Yes, I've seen it. Oh, she's sleeping in room 9. No, the fuck she ain't. She's magnetized. You idiot. So now I got to give calcium gluconate. Or we're going to have a dead patient while you out here bullshitting with the cute resident of the month. I'm telling you the truth. When a patient is on magnesium sulfate, you better watch them. That's going to be your next semester. Your patient in maternity is on mag sulfate. You better watch them. Because they can go under and die. They give you a warning, baby. You check the reflexes every hour. They told you they was going down. After a while, they stopped kicking anything, much less your chin. Okay? Now, what could cause it? It's really weird with mag because honestly, with the high mag, it's so rare unless I gave it to you or your crazy behind decided that milk and magnesia was your drink of choice. We do have some older people like that. And don't ever forget that I taught you that magnesium is toxic to the kidneys. So if you ain't got no kidney function and you sipping scissor called milk and mag, then you are definitely going to become toxic. Because you can't clear it. And you got a lot of people constipated, sipping on scissor, the little milk and magnesia, and they can't clear it. So what we got? That's called an antacid. Milk of magnesia, Mylanta, Maalox. Those are all antacids. And if you got a little kidney disease and you don't know it because the shit is silent like high blood pressure, then you're just going to be in trouble because you're not going to clear it. It's going to stay on your body. So that makes sense when I say end-stage renal disease because you can't clear mag. and your nurse, who's stuck on stupid and parked on dumb, gave you milk of mag because you couldn't go to the bathroom. Seen it. Because I don't know if you know, but if you work in long-term care as an aide, you might have seen that every single doctor alive writes for milk of mag for every single freaking patient. You're an LPN already, am I lying? It's every patient. They write $3.25 of Tylenol and milk of mag. And here you come, clueless, giving this patient with kidney disease milk of mag. Not only are they hypermagnesium, but you just killed the kidneys. So that's why you gotta know this shit. Okay? Now, so treat the cause. If it was me giving them IV milk of, well, not milk of mag IV, but if it was me giving them magnesium for preeclampsia, you better believe I'm going to stop the mag and give the antidote. That's called treating the cause. Calcium gluconate is the antidote. Yes, you have to know that. It might sound weird that it's the antidote since they're supposed to be the same. But it has gluconate attached to it, so just roll with your girl. Okay? You give the calcium gluconate as an antidote. What if it's so bad we have lost our consciousness? Well, you might have to do dialysis. If you'll recall, I mentioned earlier that diuretics will decrease calcium. They're the same, so it also decreases mag. Way back up in here. It could have been that your patient had, diuretics. Actually, it's another word for low calcium. What happened to the patient? Well, they probably had diuretics. How do I treat this patient? Give them diuretics. Okay, diuretics. It lowers both. They're the same. Calcium and magnesium are the same in your mind. Every single one of these patients get an EKG. Everybody gets an EKG because they're doing something stupid with electrolytes, especially your mag and your potassium. Go to break, piss, and come back fast. And like we said, this number means that magnesium is toxic at 6 to 8. We use 6 because who wants to be waiting until 8? Decreased LOC is a late sign. The earliest sign is diminished reflexes. Okay, done with that. Moving on.